Good afternoon, everybody. Welcome to Prisma Health Oconee Memorial Hospital. I'm Hunter Combe, the CEO here. Thank you so much for being here to celebrate with us. This is just an exciting time, and it just means so much for you to come out and take the time to do this with us. We are here today to celebrate the opening of the new home of Clemson University's Institute for Engaged Aging. It's been a long time coming, and everybody involved with the project is just thrilled that we are here today. We're celebrating today not just a place, but a partnership between Prisma Health and Clemson University. And the partnership piece is so important. The place will help make that happen, but this is truly a partnership, not just with Oconee Memorial Hospital, but with all of Prisma Health. Before we go further, I'd like to recognize and welcome the elected officials and their staff members who are here with us. And if I miss anybody, if you will just let us know of your presence. We've got Seneca Mayor Dan Alexander with us. Mayor. And Seneca City Manager Scott Mulder. Scott, great to see you. Walhalla Mayor Danny Edwards. There you are. Hey, Danny. Clemson Mayor Robert Halfacre is here. We have two Oconee County Council members, Julian Davis and Paul Kane. And the Oconee County Administrator Amanda Brock, I believe, is here somewhere. Okay. We also have Addie Patterson from the office of Congressman Jeff Duncan. And we have Logan Kipling from the office of U.S. Senator Lindsey Graham. Good to see you. Any other elected officials I might have missed, or their representatives? All right, great. Thank you for being here. We appreciate it so much. Unfortunately, Senator Thomas Alexander could not be here today and because of his duties as president of the state Senate, but he has played just an absolutely essential role through many years in the Institute for Engaged Aging, so I wanted to acknowledge him. So over the 15 years I've been here, we've had a lot of milestones and achievements here. All of you have seen the transformation of this campus and this hospital over those years, but this project really holds a special place in my heart because so many people have been involved and helped move it forward and stayed persistent and overcome various challenges and obstacles, not the least of which, of course, has been COVID-19. So it's just taken a lot of persistence to bring it to the point that it's at now. The place and the partnership that we're here to celebrate today really started to really gel and come together in discussions with Cheryl Dye, who was at the time the leader of the Institute for Engaged Aging, and Dr. Leslie Hosfeld, the Dean of Clemson University's College of Behavioral, Social, and Health Sciences. But a lot of other people in this room helped shape the vision, the idea, and led us to where we are today. Some of those people are here with us. Dr. Scott Sasser from Prisma Health helped shape the project. Dr. Peter Tiltmeyer, Clemson's Dr. Windsor Sherrill and Marika Van Pembroke, and Dr. Brenda Thames from Prisma Health, all throughout the years, participated in meetings and discussions and helped shape the project as we know it today. Then, building on the work of all of these people, Dr. Leslie Ross from Clemson University has just been a powerhouse in bringing all of this to life, and you will see the incredible work that she and her team have done when you go upstairs and actually see the space and all the work that's going on. So since 2009, when we moved into this building, what we call the new patient tower still, the floor that the Institute for Engaged Aging is now occupying was vacant. So it was vacant for 13 years. And to see it transformed and back to life is just absolutely wonderful. We had started renovating the space a number of years ago, and then COVID brought the project to a halt. And really, it was stopped for about 2 years. So it's especially exciting now to see that we're here and it's open and there are people in it and it's come back to life. So thank you for being here to celebrate with us on this important day today. Now I'd like to introduce Dr. Jonathan Gleason, who's the Executive Vice President and Chief Clinical Officer of Prisma Health, who's going to share our vision for improving the health of South Carolina.
Thank you very much, Hunter. Good afternoon, everyone. What a privilege to be here on this great day, this beautiful South Carolina day, talking about something that has been in the works for many years and over a couple of difficult years, right? I think for all of us, and to see it come to fruition, all the hard work is just a great pleasure. So on behalf of Prisma Health and our 29,000 employees, I just want to thank everyone here in the room who's participated in this. So I'm relatively new to the region. For me to see this kind of engagement with wonderful academic partners in our community and our many partners across the community is just a wonderful thing to see. So at Prisma Health, every day our 29,000 folks get up to serve our purpose, which is to inspire health, serve with compassion, and be the difference. And as you're here in this facility, you'll feel that. And when you go and you walk around, you'll feel that and you'll sense that. And we recognize that we want to partner with as many as we can to serve that purpose, right? For us to accomplish our goals and to serve that purpose, that means great partnerships with great organizations, and Clemson is just a great example of that. So, I'm very inspired by the partnership, by the focus on this particular community that we want to serve well. I'm excited about the potential on the academic side for our partnership to grow in discovery and knowledge and innovation and how we serve this population together. So I think when I think about where this is going to go, I think the combination of our clinical experts, our research scientists, and our academic partners is going to take us to places that we today can't even imagine. And so I think the potential here for this kind of partnership in this community is really tremendous. So thanks to all of you. I want to thank the Clemson University College of Behavioral, Social, and Health Sciences and all of your many partners who are involved in bringing this effort to bear, and just want to say how much Prisma Health is proud to be a part of this and excited about the impact that it'll have on the lives of the people who live in this great region. So with that, I'm going to introduce Dr. Clements. Thank you so much for being here.
Thank you, Dr. Gleason. Good afternoon. Go Tigers. Thank you all for being here for this special announcement on this absolutely beautiful day. Thank you to Prisma Health and to Prisma Health's Oconee Medical Campus for this very special and incredible opportunity to work together to make a difference in lives of many. And Dr. Gleason, I scribbled out a note. I love that you said you want to be the difference, and that's a goal of Prisma Health. This project, this initiative has so much potential to be the difference. I do want to thank Hunter Combe for his leadership of Prisma Health's Oconee Memorial Hospital, and Dr. Gleason for the important work that he leads that benefits so many people in our upstate communities. Would you please help me thank them for their leadership? So I also want to mention this is not related to today's event, but I have to say this. A month ago, my daughter Hannah gave birth to her little daughter Eva right here at this hospital, and I can tell you that Hannah said the service that she received, the care that she received, and that little Eva received, the support, was nothing short of spectacular. In fact, so I'm blessed with 3 grandchildren. 2 of them were born here, little Eva and little Eliza, and they could not have had better care. So as a member of the community, thank you for what you do, Hunter, for you and your entire team, for the amazing and important work that you do and the incredible care that you provide. So related to today, strategic partnerships like the one that we are celebrating today are critically important to our work as a land-grant university. And as a land-grant university, here's what we focus on. We focus on education. We focus on research and public service and outreach across the state to improve the quality of life and improve the economic well-being for all citizens of the great state of South Carolina and this region. Partnerships are important. They're important to our teaching. They're important to our research, which is dedicated to solving real-world problems. And the good news is we've been partners for a long time, a real long time. So Clemson and Prisma Health have been working together literally for decades, and we have a very special and very unique partnership. Our first healthcare research project that we did together actually was a biomedical initiative It was back in 1990, so more than 30 years ago. So this kind of collaboration is not new for us. Since then, our level of collaboration has increased significantly, and so has our impact. In 2013, Clemson was named as the primary research partner for Prisma Health, and that provided an opportunity to work together even more closely and to leverage our collective expertise in research and clinical practice. As a result of this very unique clinical university model, Prisma Health was designated as an academic health center. Important to point out that only 2% of healthcare systems in the entire country have that designation, and it's a very impressive designation to have. So I think that speaks volumes of the quality of Prisma Health and the value of partnerships like the one that we have with them. Numerous Clemson senior level faculty members are involved in healthcare and research collaborations with Prisma. And we have a lot of postdoctoral students who are working as embedded scholars within Prisma Health on applied clinical research projects. This embedded scholarship allows researchers and clinicians to work side by side, hand in hand, together to solve real-world problems in healthcare delivery for the community members of all ages, beginning with prenatal care all the way through the Institute for Engaged Aging. In 2018, we expanded our School of Nursing and opened a beautiful new facility in Greenville. If you have not seen this, it is absolutely world-class, spectacular in every sense of the word. And I really believe that what we are doing today, this ribbon cutting in this new home for this institute, is yet another new chapter in a great partnership. And I believe that our founder, Thomas Green Clemson, would be incredibly pleased with this initiative. He created Clemson to have an impact, to make a difference in the lives of others. That's why we were created. That's why you were created. So this building and our other healthcare research collaborations with Prisma Health are helping us to fulfill that vision. I love that you said it's more than a facility, more than a building. It's a set of initiatives. It fulfills our land-grant mission, and it will absolutely make a difference for the people of the great state of South Carolina. So our partnership with Prisma continues to be a win for Prisma, a win for Clemson, a win for Oconee County, and a win for this great state. And to tell you more about the impact of this initiative, I would like to introduce Dr. Leslie Hosfeld, Dean of our College of Behavioral, Social, and Health Sciences. Would you please help me welcome her to the podium?
I want to thank each one of you being here today. I can't tell you how happy we all are. As Hunter, as everyone has said, it's been a long time in coming, and so for you to take time and celebrate with us means so much. I'm particularly grateful to be able to thank Hunter in person, in public, because when I first got to Clemson, my very first meetings that were not on campus were right here at Oconee Memorial Hospital, meeting with Hunter Combe and Jean Ward, and walking the 5th floor, and we met regularly and tried to make this thing come together. Hunter has been the cornerstone of this partnership, and Hunter, I know I've thanked you in emails and Zoom and at football games, but to thank you in public means so much. We appreciate all you have done and continue to do to make this partnership deep between Prisma Health and Clemson University. None of this would happen, and we wouldn't be here today except for one person, and that's Dr. Cheryl Dye. Cheryl was the founding director of the Institute for Engaged Aging. She started this work in 2006 and assembled a group of researchers and practitioners and scholars and students and local, regional, and state partners, all focused on improving healthy aging for South Carolinians. Cheryl and I met every other week from 2018 to 2020 in my office, rolling up our sleeves, looking for funding, trying to figure out how to make this thing come together. This is Cheryl Dye's dream. And so would you please help me thank her for her leadership and vision. when I got to Clemson in 2018, there was an endowed chair position sitting dormant. It hadn't been used, it wasn't aging. And so I gave a lot of thought to where would it best be housed so that it could grow research and really make a dynamic institute on a big scale and grow scholarship. And so I started meeting with Dr. Pat Raymark, Department of Psychology, and he and I quickly agreed the right spot was psychology. We crafted an announcement, a job advertisement for aging and cognition. We assembled an incredible team of a search committee with Prisma partners and Clemson University faculty. We asked the provost to bless the search, and he waved a wand, and then we did a national search. And so guess what happened next? We found the perfect person. Dr. Leslie Ross joined us in 2020 in the middle of COVID. And as Hunter said, COVID slowed our renovation down. Didn't slow her down. She came in with grants. She assembled a research team. She got moving. Our renovations on the 5th floor halted for 2 years because of COVID, because of supply chain, because of contractor here or there. But we turned to Hunter. He found space for her on the 2nd floor. And she got moving and shaking and grooving, got it all going, and she hasn't slowed down one bit. I'm so pleased that you've joined us. And so she moved from the 2nd floor to the 5th floor that you'll see later today. You know, projects come and go sometimes based on people or funding. Someone gets something going or funding gets something going, and then that person leaves or the funding leaves and the project goes away. That is not the case here. We have great transition here. And so wonderful, inspired leadership from Dr. Dye, passing the baton to Dr. Leslie Ross, the Smart State, Smart Life Endowed Chair in Aging and Cognition in the Department of Psychology in the great College of Behavioral, Social, and Health Sciences at our amazing university, Clemson University. Please welcome Dr. Leslie Ross.
Well, those are tough acts to follow, but I will give it a go. I want to first say thank you, Dean Hosfeld, for your support, for your leadership, and continuous support as we've expanded what was the original IEA. I also would like to thank all the leaders, both from Clemson as well as Prisma Health, who were pivotal in making all of this happen, and that has not just been at the start, but as we've continued to grow. This is a very exciting day for both institutions, for me, as well as for the many other researchers who do groundbreaking work at the IEA. Of course, we've been calling this a kickoff meeting for a couple of years, but I'm very proud to say that we've already done so much in this space as we've waited for the appropriate time where we could meet safely together and celebrate its opening. The fact that the Institute now has a dedicated space is truly exciting. Both Clemson University and Prisma Health recognize that a focus on healthy aging requires researchers and clinicians from multiple disciplines to bring their expertise together to solve the problem. That convergence of research and clinical disciplines is happening right here, right now. Together, we're looking beyond the traditional metrics of healthy aging towards a model that focuses more on quality of life and fulfillment throughout the lifespan. Our research is keeping older adults happier, healthier, and independent for longer, while also fighting negative stereotypes usually associated with aging. We're privileged to have the opportunity to directly engage with a diverse group of older adults, not only as patients and as research participants, but also as partners so we can achieve our mutual goals. It is a continuing partnership that increases our success in translating the research into usable products and technologies that can help communities within South Carolina and across the world. Our work is already part of a large multi-university research project funded by the National Institute of Health and the National Institute of Aging. This project, called PACT, is the largest primary prevention trial to date to test the effectiveness of a computerized cognitive intervention on delaying or preventing Alzheimer's disease and related dementias. The effectiveness of this program is due in part to our prior work, where we showed a 30% reduction in Alzheimer's disease across 10 years as a function of this program. So we're very, very eager to see the success of this project and how we can bring these programs to the local community. This is just one of the many exciting projects going on at the IEA. We have faculty from numerous Clemson colleges and departments who are studying everything from the effects of social isolation on cognition, as well as fall prevention and how technology can help to keep adults in their homes safely for longer periods of time. I'm happy to say that the common thread across all of this work that ties us together is the push for tangible research that directly and positively impacts older adults, their families, and the community at large. Thank you again for coming today, and thank you for the continued support of our mission. I'm very excited to see where we go from here. I'd now like to introduce Dr. Peter Tiltmeyer, the Chair of Department of Medicine at Prisma Health.
So wonderful. Everyone's spoken to how long this has taken. It's truly been a passion for a long time of all of us at Prisma and at Clemson to bring today to life. And it is exceptional to see what Leslie has done in such an exceptionally short time that has been challenging as she joined the Clemson and Prisma Health communities. We are certainly at Prisma Health focused on addressing the needs of our unique communities and populations across the state, and we understand that those communities differ and have differing needs as we look at them. We also understand that medical care in those communities is only one factor of our overall health outcomes, and we see great opportunities across the state to find ways to address the other factors that can address health outcomes in the great state of South Carolina. In the case of Oconee County directly, we understand that our percentage of individuals over the age of 65 is 25% higher than the rest of the state. Somebody once said, go where the money is. It's great to have you here, Leslie. We want to provide care and programming that is intentionally serving this community in the best way possible. We also, in the last year at Prisma, undertook an effort to better grasp the impact of dementia on our communities. According to 2021 data, 48% of the more than 98,000 South Carolinians with Alzheimer's dementia are in the upstate or Columbia regions. We have a tremendous opportunity to impact, and more than that, we have a responsibility to impact the care of our patients. Unfortunately, those numbers are expected to increase steadily over the next 5 years, and we need to be able to address that. With that, Prisma Health last year undertook a program to become a dementia-capable health system to better support our patients, families, and caregivers across the continuum of care, including many of the teams at Prisma and in collaboration with our groups in Clemson, neurology, primary care, rehab, psychiatry, Care Coordination Institute, primary care, PACE program, and geriatric medicine. 8 individual large groups of people coming together to form a tremendous team that will drive us forward. And with that, the Institute for Engaged Aging at Clemson as a major driver in those efforts. The programming, therapy, and research offered by Dr. Ross and her team speak to our holistic approach to healthcare. We'll have the ability to work collaboratively with our Clemson partners to build our knowledge base across the important field of gerontology, enabling us to learn information that will allow us to take to a better place our aging populations as we move forward. Through this partnership, we believe we have the right people in the right place, serving our patients all the time. It is absolutely a joy to be part of today's celebration, and I'm going to hand it back to Hunter to wrap us up. Thanks.
The old mask and the glasses problem. Thank you so much again for being here. Now's the fun part, and I hope everybody will stay and tour the space. But before we do that, we're going to symbolically cut this ribbon. When we're done, there's refreshments here in what we call the connector, And there's folks ready to take you up to the 5th floor to take a look at the space as well. If the folks on the front row will come up and we'll cut the ribbon. And the giant scissors are coming in.
Cheryl, you should be in the middle.
Okay, so we're going to take a photo with mask on, and then if you would like to take your mask off when we cut, you can do so. Okay, so we'll take two photos.
I had an extra.
I was going to get you one.
Thank you.
I can't have you in a picture without.
Everybody now just step towards the ribbon for us. Don't cut them.
Punch it, punch
And if you will squeeze into each other, you're going to be uncomfortable close. So everyone pause right there. Don't cut quite yet. Everyone will look here and smile with their masks on. You're going to get a few pictures before everyone does this. All right, keep smiling. That looks fabulous. Yes, tell me when you're good. Okay, and if you would like to take off your mask for the actual setting, you just tuck it in a pocket. Pause one more big smile, and then we will count it off for you, okay? Smiling, those things are good.